I'm not the house of cards that falls down easily. I'm strong enough to handle what you're throwing me.
Welcome to Mental Health News Radio. I'm your host, Kristin Sunanta Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Hello, everyone, and welcome to another roundtable edition of Mental Health News Radio. We're here with Dr. Paul Meier. Hey, Paul.
Hey, Melanie. Hello,
hey, Kristin.
Hello. Thanks for doing the intro tonight, Melanie.
Sure. We are going to talk about something that we hear a lot about in mental health these days, and that is eating disorders, anorexia, bulimia, binge eating disorders, the whole gamut. We're going to try to unravel this topic a little bit today. Paul, why don't we start with you, and you tell us what you know about eating disorders.
I wrote a book years. I know you're surprised, aren't you?
I know. What haven't you written a
Another
book
book.
I wrote a book years ago. In fact, the publisher called me up and said, and for our listening family who haven't seen any recent, any pictures of me or anything like that, I'm 6'4", and but I'm about 40 pounds overweight, and I've been that way most of my life. So, whatever advice I'm giving today on weight reduction, I won't give any on that because I don't really know how to succeed in that myself. I know how to, but I guess I'm too lazy to do that. But anyway, I do know quite a bit about. So when the publisher asked me to do a book on eating disorders, I told him, I said, well, I can't do one on that because I'm overweight. And they said, well, just talk about that in it. So I did, But anyway, I wrote a book called Love Hunger, and I wrote it with a nutritionist and with a couple other. Another psychiatrist and a psychologist, and it talks about anorexia and bulimia and other kinds of eating disorders. And it did real well. I think it sold about 700,000 copies, but I think it's out of print now, so I think you'd have to get it at Amazon or at Barnes & Noble, and they'd probably have some inexpensive copies now if anybody wants to get a copy. But anyway, I'll just kick it off with a few things like bulimia. Our clinics, the Meier Clinics, used to own Remuda Ranch in Arizona, where there'd be 100 women at a time that would be in the hospital for 6 or 7 weeks to get treated for anorexia and bulimia. And we don't own it anymore now, but and so we've had a lot of experience treating people with those things. And I remember asking the head nurse when I was starting to do research for this book, I said, what's the most common factor that you see in gals with bulimia and also anorexia, but particularly in bulimia, so that's a lot more common. And for those who don't know, bulimia means where you're vomiting on purpose for weight loss. And I had read about that, but it sort of surprised me that they thought it was the number one factor was over-enmeshment with mom. Bulimics tend to be from wealthy families, a lot more than poor families. And the most common, and there's all different reasons why people could develop bulimia. Okay, some were sexually abused, but a lot of them weren't, and all that sort of thing. But the most common family that would end up accidentally producing bulimia it's a family where the mom and dad are really both pretty nice people, but dad is a real successful businessman, or he could be a doctor, lots of times a doctor or a pastor of a large church or something. So dad's successful, but he's real busy in his job. Mom's a nice person, but mom and dad don't have time to have much emotional intimacy with each other. So they have several kids, and mom picks out one of the girls to become her best friend because she's not close to her husband. And what she ought to do is become best friends with somebody her own age. But some women just don't do that. And it's okay to be close to your daughters, but it's not good to be your daughter's best friend and for her to be your best friend. She needs to have best friends her own age. You need to have some of your own age. So the mom and daughter become too enmeshed. Sometimes it's the mom thinking totally for the daughter all her life and controlling the daughter. And sometimes the mom makes the daughter into the therapist and teaches the daughter to control herself, the mother. But it's more common for the mom to control the daughter. But they're so enmeshed that they're talking to each other a whole bunch every day, including about their secrets and their problems and even problems with dad and things like that. And the girl goes off to college and the mom's on the phone with her an hour a day. And one of the first things we tell a bulimic, if we treat a college age bulimic, is you can only talk to your mom 10 to 20 minutes once or twice a week. And when you talk to her, you can't talk to her about any of your problems. You can talk about politics or religion or something else, but not about your own problems. And that just drives both of them crazy because they're so used to being overly enmeshed. And
I was going to say, how do they respond to this? Because I can imagine they have huge withdrawals, but then you start seeing the progress, and I would imagine the daughter, especially being in treatment, starts seeing the progress over the course of time with this not being in constant communication with mom.
And then one other real common thing we see is they tend to be real perfectionistic, especially the anorexics, but anorexics and bulimics are real perfectionistic. They're very successful. A lot of them are cheerleaders. It's almost a requirement to be a cheerleader if you're bulimic. It's almost a requirement to be bulimic if you're a cheerleader, but not all cheerleaders are bulimic. Not all bulimics are cheerleaders, but they're perfectionistic performers. So we've had a lot of Olympic athletes that were bulimic and gymnasts and all sorts of, and it's way mostly women and very few men that get it. And so that's what I'm going to use to kick it off. I don't really know the reasons why. I know we learned that bulimia, is get-written syndrome in residency. That because you're vomiting up not only food, but you're vomiting up your life. But I've had a lot of patients that were on the verge of death that were eating 20,000 calories a day and still staying slim because they were, vomiting them all up multiple times a day. And, and so let's kick it off. Melanie, I know you've had a lot of experience treating them, but those are just some of the common things that I see. And one more thing that's real common is among the anorexics, a lot of them seem to be afraid of their femininity, and they get it usually most commonly, at any age a person can get it, but it's most common when they go into puberty and start developing breasts and thighs, and so when you're anorexic, you look neuter, and so they may be afraid of their femininity and become anorexic. Also, it's something they can control. Even though they're out of control, they feel like they're in control of something. And if mom or dad are way overly controlling, then starving themselves to death is one thing they can feel like they're in control of. So with that, I'm going to kick it off and let's open up the discussion and share other things that you gals have observed and the whys, because I don't know all the whys. I just know the whats, So go ahead, gal.
Well, I would agree with your statement. There definitely is a high coincidence with enmeshed mothers and daughters and bulimia. I definitely saw that time and time again. Looking back on it, I would even go as far as to say a narcissistic mother. So the daughter is really unable to have her own life. She's unable to have her own feelings, or she's always, quote, swallowing mom's feelings. So there's an urge to purge them out. So I think sometimes that's part of the why, because if you think about the binge purge cycle, almost every bulimic that I ever saw, there was a high rate of shame attributed to the vomiting. There was just it was a self-punishment. It was a way of self-punishment. And I think sometimes that's the case. It's a deeper feeling of self-hate. It may start with perfectionism with anorexia, but I think there's more beneath it than that. I think it really is. It's self-hate. It's not allowing, because most anorexics, it's not only food, they don't allow anything in their life. So they very seldom allow joy. They don't allow just anything, emotions from other people. They take little breadcrumbs from relationships. They don't require a lot from anyone. They may come off as being highly selfish, but in the reality is they're depriving their lives of everything. So I feel like an anorexic is really different from a bulimic, but then you've got this spectrum too. But you've got this spectrum, and you know this, Paul, if you've treated them, that sometimes they start off anorexic and then they become bulimic, and then they go back to being anorexic and then they become binge eaters. So a lot of them kind of go up and down the spectrum, but there's definitely a difference. But there are some, quote, and I just call them true anorexics, and they really present differently than someone that ends up on the spectrum and moves up and down all the eating disorders, because I think there's a lot of women that do. And they're kind of those, quote, true bulimics too, that it's just, you know, they've got the teeth that have been, they're completely eroded away. I mean, I had a client that she got detained in a grocery store because she was so malnourished that she was standing where the meat was eating raw beef. And I mean, that she was so depleted that was what she was eating. That was what her body was craving. So, and she was in and out of treatment for years and years, but luckily she's happy and well and has children now. But I think eating disorders are really complicated. I can tell you that the clients that I had with eating disorders, it was some of the hardest clients that I had, because you feel like you're in this real battle with the eating disorder. The eating disorder has a mind of its own. Time. It really does. Yeah. You have to learn how to start separating the person from the eating disorder, because it's just like an addict. They're friends. They're friends with the eating disorder because this is what gives them emotional comfort. And that's what they're doing when they're binging or when they're not eating. They're getting something out of it. So it's very hard to separate them away from the eating disorder. And you know, anorexia and eating disorders is the highest death rate of any mental illness. More people die from eating disorders than anything.
Yeah, people don't realize that. I mean, we know that if you gain a lot of weight, you're likely to die sooner from heart attack or stroke, you know, and maybe by 5 years, something like that. But an anorexic is somebody that weighs 20% or more below the recommended weight for their height. So if somebody's supposed to weigh, like a 5-foot woman, I think the ideal weight for a 5-foot woman is around 100 pounds. So if a 5-foot woman lost, what would be 20%? That would be 20 pounds, right? If she got to 80 or below, then there's a 15% death rate. So it's actually more dangerous to get too skinny than it is to get overweight. But there's a 15% death rate with anorexics. And that's pretty high. And a lot of bulimics, they mess up their metabolites, you know, the sodium, potassium, and those things. And their heart can just stop beating just because they're vomiting the electrolytes that they need to maintain a heart rate. And like you said, they rot their teeth. They're destroying themselves in a lot of different ways. I remember I went to a concert in the Hollywood Bowl here, Karen Carpenter and her brother sang, and it made me so sad when she died of bulimia. But a lot of people die from bulimia, and they don't realize how dangerous it is.
Yeah, it is really dangerous. It's you know, and you know this, Paul, when you get below a certain weight, basically antidepressants don't work very well. So it's very hard to medicate these young women because their bodies don't respond to medication when they're so
Right.
underweight. And this is one of the hardest things about treating someone with an eating disorder, because the eating disorder has served a purpose. So for example, when you have an anorexic and you're trying to refeed an anorexic, when they start eating normally and they start getting to a healthier weight, they're overcome with this immense wave of feelings. And this is because, number one, when you're underweight, it numbs your emotions. You literally are not able to feel as much. You don't feel sensitivity as much. Your emotions aren't the same when you're underweight. So you're literally numbing out your emotions when you're anorexic. When they start eating again, then literally this not eating has been their way of controlling being overwhelmed to begin with. So when they start eating again, all of a sudden they're just absolutely overwhelmed. So of course, what are they going to do? They're just going to start starving themselves again. So that to me is the real key of treating young women with eating disorders, is teaching them how to deal with their emotions, how to have more emotional awareness, how to recognize it, give them tools for anxiety. Anxiety is a huge problem with anorexics and bulimia too. But at the whys, Paul, and then we'll chime in with Kristin. I think it's very complicated. I think it's a coping skill. It's a symptom. If to me an eating disorder is a symptom of something deeper, it's a coping skill of not knowing how to handle life. I feel like a lot of the young women I saw were highly sensitive young women, and maybe they had not been attended to as almost emotionally neglected as children, not on purpose. It was just that the parent didn't know how to meet the child's emotional needs. And so I think sometimes that can turn into an eating disorder. So I think it's a variety of reasons. And then sometimes it's as simple as it starts off as a vanity issue. It starts off with trying to lose a few pounds, and then it becomes so rewarding, then they just continue on and there's no turning back after that. So I think there's a lot of whys, Paul. That's what I'm saying. Yeah. I think there's a lot of whys.
Yeah, another one that I thought of while you were sharing that is, if you have, if for those of you in our listening family right now who are raising children, don't praise them very often for their looks. It's okay once in a while to say, you really look pretty today, or you really look handsome today. But whatever you praise them for is what they're going to base their self-worth on. Mm-hmm. So what you need to be praising your kids for is, boy, I was really impressed when you went out of your way to help Johnny, your brother Johnny today, the way you were so kind to him when he was crying, and what a sweet person you are. And so praise character, and don't just say you're a good girl or you're a good boy, but praise them for specific things that they do that are character things, and then they'll base their self-worth on being good people rather than on being good looking. And if they hear a lot of praise on their looks, then they're going to base their self-worth on their looks and be more likely to become bulimic or be afraid of it and become anorexic.
Yeah. How about you, Kristin?
Well, I always chime in with the patient perspective, and neither of those things were things that I gravitated towards, but I certainly had family members and friends who had either one or both of those things. Mine always was binge eating, emotional eating, but I never purged. And I think I got away with being very thin until, well, not very thin, but just healthy body weight until my early 30s, because I did a lot of exercise. And so I just, but I still, emotionally ate. So in my family and with friends, what I see with the bulimic side, it was absolutely situations where there was a lot of trauma and many times sexual abuse that was going on in the home. And it was their one way. It was almost, my friends, especially the ones that suffered from anorexia, it was like this precious gift in the way that they twisted it into in their mind. It was something like, don't take this away from me, because it was like the only thing they had control over was the food. They would just get into arguments about being unhealthy, and arguments about, like, if you try to take away this, anorexia from me, I am going to fight you tooth and nail. Don't take this away from me. So that is something that I noticed. And I also noticed anytime that other stressful things, like a friend that got married and everyone kind of questioned the marriage, it seemed very rushed and unhealthy. And all of a sudden, in, a very short amount of time after the wedding, they look so thin, dropped, and in an unhealthy way, the ways that they had looked before when they were active in their eating disorder. So any type of stressor in their life as an adult sent them right back to that place where they could control the one thing that they could control. So that's been really my experience with anorexia. With bulimia, it was really, you hit the nail on the head, Melanie. I mean, the purging of all of this emotional stuff that you never put on your children. And the mother typically, but also with sexual abuse, usually with the father or brother or uncle, they were just, the vomiting was about purging not only their own stuff, but everybody else that was, that was dumping everything onto them as well. So those are my two experiences, or what I saw with these two things.
Another thing among the anorexics is they have body dysmorphia, you call it. They can be, 5'6" and weigh 78 pounds, and they'll think they're fat. They'll look in a mirror and they'll see that their stomach isn't perfectly straight up and down, because it's not in anybody, no matter how skinny you get. And they think they're fat. They look at that and they say, "Look, that's disgusting how fat I am." When they look like a concentration camp person from the Jewish camps back during if you've seen those horrible pictures, I've been to the Holocaust Museum in Jerusalem and in a number of different cities, and you see the pictures of how much they suffered. Nazis starved them to death often, but when you see an anorexic, they look just like somebody that's been in a concentration camp, but they may still think that they're overweight. And the reason medications won't work in them when they're that so thin is because you have to have you have to have tryptophan, phenylalanine, tyrosine, choline. You have to have the essential amino acids in your diet to build up the brain chemicals. And then when you take an antidepressant, it helps you to hang on to the serotonin. But if you're not eating right, then there's no serotonin to hang on to, because you have to eat enough of the right things to build up serotonin so that the medicine has something to hang on to and it can accumulate. And so if you're not eating right, the medicines won't work.
That makes sense.
What do you think about that piece? Because, I'm not someone who's treated people, obviously, for any of this, but that piece about, new stressors that come up in life later and that they run back to what worked in the past. And I know that happens, of course, with substance abuse and so on. It seems a little more, like you said, Paul, the body dysmorphia. You can see that they are physically looking very unhealthy, and yet that may be the time when they are taking the most pictures of themselves. And you don't do an addict that doesn't necessarily, go out and, they're back on, alcohol or crystal meth or whatever, and now they're snapping all these pictures of themselves in bathing suits and so on. That doesn't seem to happen, but it does with an eating disorder, from what I've seen, especially anorexia. And if I'm completely off base, let me know.
No, I don't think anyone's ever completely off base when it comes to eating disorders in a lot of ways. I mean, most of the time, especially with anorexics, there is a body dysmorphia piece of it. And that just means that when you look in the mirror, you don't see what you really look like. And that's what body dysmorphia is. And sometimes it has to do with eating disorders, but other times it can be a person is obsessed with the way their nose looks and they think it looks a certain way, but it really doesn't. It really is almost like your mind's playing tricks on you. So when an anorexic looks in the mirror, they see someone fat. That's why one of the exercises that I've seen done at clinics, and I've done this in my office too with clients that did really struggle with body dysmorphia, is you get them to lay down on a piece of paper, on a huge piece of paper, and you trace around them, you trace around their body so that they can see the shape of what their body is, and it's always completely different than what they actually see in the mirror. That can help sometimes to try to help them see what they really look like, because really their minds just play tricks on them. They don't see themselves as being skinny. They still believe that they're, too fat. So it could definitely play tricks on you, for sure.
What was successful in terms of treatment, Paul, for you? What were things that were consistently successful?
Yeah, and we have had really good luck. In the early days, people would consider bulimia almost incurable and anorexia almost incurable. But the vast majority of the gals or the guys in some cases that get treated for it, if they get the right kind of help, that they can get over it. And like an alcoholic, they may have a tendency. Some of them may have a tendency to go back to it, but I've seen a lot of them that got over it and didn't go back to it at all. And when we're doing therapy, we don't talk to them about the vomiting. See, a lot of doctors, regular doctor that's not a psychiatrist, would think their problem is that they're vomiting, or the problem is that they're starving themselves to death. No, like you all said earlier, that's just a symptom of the problem. The problem is what's going on in their unconscious, and it could be the smothering mother, or it could be sexual abuse. It could be other factors. One patient I had, when she was a little girl, she burned herself in the genital area, and so when the doctors had to remove her skin and operate on her and do things day by day and treat her, remove the pus wounds day by day, she felt like she was getting raped every day, and that ended up causing her bullying later. But we deal with the root problems, and if they weigh, we don't let them look at their weight. We have them look away so they don't even know what their weight is. But we don't talk to a bulimic about their weight or about eating or about things like that, except for what's absolutely necessary. And usually we'll let only the MD do that, but the therapist talks to them about their anger, their independence, their anything that's eaten away at them on the inside. Like Mark Twain once said, "It's not what you eat that gives you indigestion; it's what's eating you." And so we treat them just like we would anybody else with any other kind of problem. We dig, we probe, we use Gestalt techniques. Where, like, if there's somebody that's hurt them, put that person in an empty chair and tell that person the person that they're imagining being there, how they feel, getting them to cry. A lot of it stems from the first 6 years of life. So going back to early childhood experiences and getting aware of them and sharing them, sharing their dreams that they're having. And then if they're hospitalized, and if somebody's vomiting a lot, if they're vomiting every day, they really ought to be treated in a hospital. We've got a Christian unit in Timberline Knolls, is a hospital in the Chicago area, Timberline Knolls, and it's not our own unit, but we've got they use our materials and our therapists help them out. So that's a good place where women can stay for a month or 6 weeks. But they need hospitalization if they're anorexic, if they're 20% below their recommended weight or more, or if they're bulimic and vomiting every day. Then they really need to be treated in the hospital. But we dig and probe just like we do anybody else, and dig out root problems, and it just takes about, for most people with depression or panic attacks, we can get them pretty well over it in about 3 weeks in our day program. But if they have anorexia or bulimia, it might take 6 or 7 or 8 weeks. It takes longer. It takes about twice as long to get them in touch with their emotions and that sort of thing.
Yeah, it's so hard to break through that barrier. let's talk about sexuality for a minute because I think it's a real important conversation to have. And I'll give a case study. I had a young woman that was anorexic, and I felt like she was, quote, a true, a real anorexic. It was, she just had that perfectionistic type of thinking, and all of the exercises that we would do, she was extremely perfectionistic in how we did things, and oftentimes would ball paper up if she wrote a letter wrong or anything like that. But that was just the symptoms. So those are the symptoms. Well, her father wanted to come in one day to the session, and of course, you always want to try to involve the family when you're dealing with these things. So dad comes in, and dad's a nice guy, respected in the community, but one of the first things dad did when he came in the room was look at me sexually. And immediately I was like, okay, this may be contributing to the problem in this household, because I really think that the root of one of this girl's problems was when she was a little girl and she liked to wear My Little Pony shirts and stuff like that all the time. She was still very caught up in Disney movies. She just wanted to be a little girl. So when she was a little girl, her daddy treated her like a little girl. But I think maybe daddy was really uncomfortable when she started to become a teenager, and she felt that. And that just kind of started off. She was afraid of dad anyway, and I could tell. I mean, he literally told me in the session and actually acted it out like he was holding a knife. He told me in the session that he wanted to kill her eating disorder, and he acted it out, and like he had a knife in his hand and he was slamming it into his other hand, and she was petrified. I don't think there was any abuse. I don't think there was any physical abuse or anything like that, but she was afraid of him. And so I saw the family out another time, and again, I immediately noticed that he looked at me. So sexuality can be a huge piece of anorexia, and sometimes bulimia too. Just like you said, Paul, women are ashamed of their bodies. It gets them attention from men that they don't like and they don't want. Maybe there was nothing sexual going on with dad, but maybe they just had a bad relationship with dad and are scared of men. So when men start looking at them in different ways, they're uncomfortable with it. Or they just have a social phobia. They have a social anxiety, and here people are, looking at their bodies, and for some reason they feel ashamed about it. And it doesn't mean sexual abuse. Sometimes it is, but sometimes it's not. So I do think a lot of times women starve themselves so that they don't look like women anymore, and that's where they feel comfortable. And then it can go the other way, where women binge eat, or maybe because some bulimics are actually overweight. It doesn't always end up being anorexia, or if someone binge eats, then sometimes that happens because they're trying to put weight on to cover up their attractiveness, or something like that, so that men don't stare at them. So I think part of this can be cultural. I mean, it's women are objects still in our society, and we talk about this on the show. We've talked about it on other shows, and I think it can be real uncomfortable for a teenage girl that may be a little socially anxious to start to have to deal with these things. And it just becomes, again, it starts off as something different, but then it becomes something that's really a tool for them to handle something else. So I think sometimes, a young woman's sexuality is definitely involved in an eating disorder. And obviously, if they were sexually abused, that completely makes sense. Just like you were saying, Paul, they look neutral. They don't look like a woman anymore. They want to look like a child. And sometimes that's it too. I've had 2 clients that were anorexic, and I honestly felt like they were just stuck in childhood. They started to go out into childhood, or to adulthood. It scared them half to death. Their parents were enmeshed or overly protective. They go out into the real world. It rocks their mind, and they literally just want to be a little girl again. So they become anorexic.
Yeah, I think you're right that in some cases, if the dad's overly sexual and he's noticing every pretty girl that goes by, then a little girl growing up would tend to see herself more as an object and then be frightened when she develops in puberty. also there's a lot of men who aren't that way, who aren't flirts or anything. They're good men. Yep. And they love their daughter and give them hugs and hold them on their lap to watch a funny TV show or something, or play games with them. But then when the daughter does develop breasts and thighs and start looking like a woman, he pushes them away because he doesn't want to have any kind of sexual thoughts about the daughter. And he feels like if he thinks, wow, she's really cute, that there's something wrong with that. There's nothing wrong with thinking your daughter is cute. But they feel guilty for having any kind of thoughts even related to that. So they push their daughter away. And so the daughter can feel like becoming a woman is making her lose her daddy. And so if she becomes anorexic, then she's not a woman or a man. She looks like a neuter.
Why don't we talk about males and eating disorders? And did you ever treat a male patient at Remuda when you guys owned that? Have you ever seen a male that was anorexic?
They don't at Remuda. They purposely only have females there because they don't want to mingle them together. But yes, we've treated some male anorexics. Like I said, they're pretty rare. And for some reason, the majority of them are gay. That's no criticism of gays. It's just, I guess, since mostly women get it, then a male homosexual would see himself as being a woman. I know in our culture, beauty is different now than it was in the 20s and 30s and 40s. Sometimes my wife and I like to watch these old movies, the movies from the 30s and 40s and 50s, and the women that were real popular then, a lot of them would be considered overweight now in our culture, but they were the normal weight then. And the models, if you looked at the models that modeled clothes and things like that back in those days, they'd be a normal size. Now, to be a model, you almost have to be anorexic, being skinny like that. That also is a factor in our culture today, for women, especially growing up. But for men who identify with women and think of themselves as a woman, I guess that would apply to them too. They want to be thin like the models, and so they're tempted to be anorexic. So because they misbelieve that that's normal, and it's not normal.
I've never treated a male anorexic or bulimic, but I've definitely known of several, and I think it's becoming more prominent as even men are held to such a standard with having perfectionistic bodies. And Paul, you and I were talking about this before we started recording. Sometimes bulimia becomes a problem, especially like with wrestlers, because they have to make weight. And then it just becomes a habit because the act of vomiting is actually addictive. And because all these endorphins are released in your body, cortisol and all that is released. It constricts your blood vessels, and there's actually a physical dependency on the binge purge process because you've got this high with the binge because you've taken in this extraordinary amount of calories, and you can kind of get a high off of that. And then when you purge, you're relieving yourself of the fullness, but then it just starts all over again. So I feel like bulimia is more associated with self-harm and also just general depression. Would you agree with that, Paul?
Yeah, I think, there's a lot of self-harm in it, and there's definitely a real high rate of depression. In what you mentioned about fear of sexuality earlier, there's a lot of, we haven't said hardly anything about being overweight.
Yeah.
But when you deal with clients who are overweight, plus, like I struggle with my own weight problem. But when you struggle with being overweight, one of the reasons that some people become overweight is to avoid their sexuality. And I've had a therapist think that about me too. I'm a Christian, and I don't want to have sexual temptations, but like every, we were taught in residency, if you're a man and you never have any, go to an emergency room quick. You're either sick or dead. So you're going to have some, but I don't want to have sexual temptations. I love my wife, and I want to be committed to her, and I don't want to see women as objects. And so I had a therapist that thought that one reason why I might overeat and keep myself 30 or 40 pounds overweight is so that women won't flirt with me, because I don't think I would ever have an affair, but still I don't even want to be tempted to.
That makes so much sense, Paul. Now that I can relate to.
Yeah, and a lot of gals that are overweight were sexually abused, and were a normal weight. They were a normal weight until they got sexually abused or raped, and then their fear of the opposite sex made them have a strong need to put on a lot of weight real quick, because if they put on enough weight, then they're protecting themselves from the opposite sex, from intimacy and sexuality. But there's a lot of reasons why people overeat. That's just one of them.
There's there's also, you can get a chemical reaction too from the overeating, and stuffing your feelings, and food becomes the place of comfort. But there can be those more deeply rooted issues, and I absolutely, hands down, 100% know that for me it's about not looking attractive to the opposite sex, and I can go quite some time doing well in terms of my weight and working out and all those things, and keeping my weight where I'm more comfortable. And if I end up attracting or having someone who's very much of a predator in their behavior, female or male, but mostly male, then I would, and I would get into the beginnings of a relationship with them. It never got farther than the beginnings of a relationship. I immediately put on a minimum of 30 pounds. Immediately.
Oh, wow. So that might be the reason for in your case.
Yeah,
and now I'm just kind of comfortable. Like, okay, I'm going to get to a place where I'm comfortable, and I'm definitely working on those issues. But you all know my background. I've talked about it, the sexual abuse piece, and I was told constantly, this is what women look like, and those were women in Playboy and Penthouse and so on. And I quickly realized as a kid, if I look like that ever, then I'm going to get that kind of attention, which makes me sick. So I am going to do everything I can to never look like that.
Yeah. Like we said before, if the listeners have family members or friends that are struggling with eating disorders, don't ever say anything about their weight. Don't talk about food. Don't, that's not the way to handle it. Really, the way to handle it is just through being supportive and helping create a safe environment for their feelings to be safe, because I think that's really what it boils down to, is that they don't feel safe with their feelings. So if you think about why people self-mutilate, it's not because they're trying to get attention. I mean, I'm sure there's been the one that has just been trying to get attention, but why would someone try to get attention? Is because they're in pain, they're hurting, and that's what the cut is about. So when they cut, it literally releases the pain. So it's not that they're trying to hurt themselves. That's generally not what they're doing. It's a release, and that would be the same as a purge. It's a release of getting feelings out that you literally just don't know how to, you're not even aware of them. For a variety of reasons, or you just don't know how to handle it, or sometimes it's trauma. This is another case study. I had a young woman that was in a horrible bus accident with her high school sports team, and several of her teammates died. And she had survivor's guilt, and never dealing with that grief. She really wasn't old enough to even be able to deal with the grief. Those feelings just stayed trapped and trapped and trapped, and eventually she became bulimic. And that to me was just how she was trying to deal with these unresolved feelings that she had. So I think, not only sexual abuse, but I just think trauma in general can sometimes be a trigger for eating disorders.
Yeah, one thing we do when we're doing therapy on people with eating disorders is is that whenever when I tell them, whenever you're tempted to binge eat, or whenever you're tempted to vomit, then stop and ask yourself, what emotion am I afraid to look at right now?
Mm-hmm.
Yeah.
Because it does numb emotions. And if they'll stop and figure out what they're afraid to look at, you know, they have to, I say, just think what happened during the 5 minutes before that. You know, maybe they saw something on television or in a movie, or maybe somebody said something to them. And whatever you do, folks, don't go up to anybody and say, you look like you lost weight.
Oh my God, that's horrible.
And I tell them, no, actually, you know what I tell them? I tell them, yeah, I've lost over 1,000 pounds now, the same 20 over and over again.
You know what I say? Honestly, what I say now is, have I? That's not really how I choose to look at myself.
Yeah. Or just
don't tell
not how,
or
I said to someone, that's not how I place my value, is in what my weight is. But thank you, if that you meant that as a compliment. I certainly thank you, because I'm not trying to be mean or to make someone feel uncomfortable, but I really want people to wake up and realize that is just not a compliment. It's not a compliment.
Yeah.
And don't ever walk up to somebody that's a little bit overweight and say, "Oh, are you pregnant?"
Exactly.
I've done that. I've done that twice.
Oh,
in my life, and I felt like an ant. Just don't ever do that. Don't ever do that.
So bad. If this is one of the worst things you can say to someone that's been anorexic, and I know it sounds backwards, don't tell them that they look healthy. Do not tell an anorexic that has formerly been anorexic at any point in time that they look healthy, because healthy means fat to an anorexic, and it's the last thing they want to hear. The best thing to do is just not comment on weight or appearance.
On their look.
Period. Don't comment on anything about their looks, because they're hypersensitive. You seem happy today. If you want to really give someone a compliment, good to see you today. Just try to stay away from the appearance comments when you're dealing with someone with any type of eating disorder.
Well, I was going to say too, everyone manifests differently in terms of if there's anything to do with a disorder of some kind that affects weight, and weight has such a negative connotation up and down, right? And across our society. So yes, just remove that from your vocabulary towards anyone.
Yeah.
Ever. Look, I told this to this NFL player. All he ever talked about was what his wife looked at, how beautiful she was, while he chased every other woman on the planet, including me. And I would say to him, you know what? Could you just stop looking at your wife as if she's an object and come up with some other description for her when you're talking about her that has absolutely nothing to do with her looks? Talk about her being a wonderful mother. Talk about her being a great linguist, or that she was great in math in school. But can you just not even think about her physicality in any way? And, of course, he looks at me like, so that didn't work. But another thing that I would say, not everyone who's struggled with weight is a yo-yo dieter. I've never been a yo-yo dieter, and many of my friends that have struggled off and on with weight have been yo-yo dieters. We really are so that's another thing that people do. What diet are you on? What diet worked? Stop all of that nonsense, because dieting has been proven not to help, and not all of us are doing that. Literally, some of us have these issues with weight up or down because of emotional things, and we're, self-conscious enough about it as it is. And so getting in some discussion about diet and exercise and so on doesn't help. And I said this to a wonderful group of applied behavioral analysis who were trying to come up with, what other industries could ABA professionals get into other than autism, where they could, do really well. And one of the things that this group at this conference came up with was the diet industry and the fitness industry. And I said something to the people that ran it later in a very nice way, but and I really mean that. I said it in a nice way, but I'm sitting there watching this, and I see the moment that they get up to talk about, well, we're going to do this business plan in the fitness and diet industry. Half of the people in that room, men and women, were quote unquote overweight. And I watched every one of those people go immediately to shame. And I thought, gosh, that's not the point of this conference at all. So I said to the person putting it on, why don't you just talk about living a healthy life wherever you're at physically, instead of talking about food, restriction, obesity. Those are all trigger words, and I guarantee you that all the people there that were trying to get value out of this seminar, half of them completely shut down the minute that you used the word obese, and now you've just lost half of your audience.
Yeah, that's very, very important, and we do that in therapy too. Is if somebody's overweight, for example, and they're bad mouthing themselves, or they feel like they're worthless because they're overweight or things like that, I try to encourage them and help them to love themselves at whatever weight they're at.
Exactly.
Learn to love yourself and be your own best friend, regardless of your weight. If you never ever lose a pound, and in fact, if you gain another 10 pounds, figure out a way to really love yourself for who you are. And Bible, you're getting a close relationship with God and meditating on the Bible and getting in relationships with people where you do have some close friends that you can share your feelings with, so emotional intimacy, things like that can really help you and remove the weight from the equation and learn to love yourself at whatever weight you're at. And then if you want to lose weight after that, it'll be easier. But like Kristin was saying, you got to work on who you are first. And again, the weight usually is just a symptom. It's not the problem. It's the symptom of the problem.
Yeah,
that's why diet don't usually work on a long-term basis. You work on
and
who you are.
You know what happens?
And you get a lifestyle. You can get a lifestyle of getting fewer carbs and more protein and you can get in a healthy lifestyle, but don't try to crash diet or anything like that. What were you going to say?
You know what happens when you do that, Paul, which is so beautiful, when you teach someone to love themselves right now, and you keep teaching them this, and you keep fostering that, and you keep, helping them go in that direction. Eventually, their whole life balances out in a way that's healthy for them. And if they're overweight, they will start dropping weight. If they're underweight, they will put on weight because they feel loved.
Yeah, I think that's true. What was the name of your book, Paul? What was it? Something
Love
about
Hunger.
Love Hunger. There we go. I think a lot of eating disorder revolves around that. It's not being able to accept love. So maybe food symbolizes love for you. You restrict yourself from love because you don't feel worthy for whatever reason, maybe because you're not perfect, or other reasons. But yeah, I think that's incredibly true, Kristin. When you can learn to love yourself as you are, then I think then you can practice self-care in a genuine way. And I just want to say that, we're talking about eating disorders, and of course people that are strangers, you always want to kind of watch what you're saying. But if you have a loved one that has worked really hard to lose weight because they want to lose weight and be healthier, and they've been successful, I don't think there's anything wrong with saying you look great. I don't think there's anything wrong with that. We can't go to this extreme where we don't give people compliments on their appearance. That's just too extreme. It's not realistic and it's not fair. So if there's someone in your life that you feel like is healthy and they're doing these things, and there's nothing wrong with complimenting someone on their looks. It just doesn't need to be extreme and the only thing that you ever comment on. But I just wanted to say that because you definitely don't want to just not ever say anything, because I think it's appropriate. I think it's appropriate sometimes. It can be seen as a compliment. And that's fine. We all should have the freedom to give each other compliments when we want to. But when someone's had problems with eating or weight, it's generally just better to completely stay away from those types of comments, for sure.
Yeah, like even with your kids, you can
Yes.
say that once in a while. Boy, you really look handsome today. You really look pretty today. Just make sure it's not something that you do a lot, or more than complimenting them. For sure, like 10 to 1, and compliment them for good things they've done.
Yeah.
Rather than how they look.
Oh, yeah. Well, sometimes it's not the parents. I mean, sometimes they might hear it from a parent, but again, this is society. I ran into that as a child. I was constantly told how pretty I was. My little brother was, or my big brother was constantly told how handsome he was. And it was just something that people said because they think they're complimenting the parent. Oh, you look so pretty, and then everyone starts saying it to you. And then literally you have this standard to live up to. Which can be really hurtful because it becomes a self-fulfilling prophecy. You can't help that you're born, in a way that people call you pretty. And so then when that's the only thing people are saying about you all the time, they don't even stop to look at, well, who's the person underneath? And so that can be equally as
good point, Melanie.
Discouraging. It can be really discouraging, and hurtful for sure.
Well, I was just saying in my own life, I was actually pretty thin most of my life, and when I was in college, I would run from class to class, and I played several different sports. And I'm 6'4", and at one point I weighed 167 pounds, which is really, pretty low for a guy. People used to tease me and say if you stood sideways and stuck your tongue out, you'd look like a zipper. Or if you drink some strawberry juice, you'd look like a thermometer, or things like that. Or in order to get, when you take a shower, you have to run around to get wet. But,
those are funny.
And I was embarrassed for being thin, and I took weightlifting and lifted a lot of weights so I could fatten up a little bit. But then when I went to medical school, then I didn't have time to exercise, and I just studied, and I put on about 10 pounds a year for quite a few years. But I think becoming a doctor, when you're a doctor, you have a lot more people that are flirtatious with you too, just because you're a doctor. Yeah. And I think part of it was the less activity and less sports and things like that. And I think part of it was a fear of being flirted with. I didn't want to be flirted with.
Yeah.
Yeah, that definitely makes things more complicated. I was just going to say, Paul, my son is 6'6", and he might weigh $150, $155, so he's super thin. His friends call him flagpole, and he's extremely self-conscious. He is extremely. Last year, we literally went to the beach for 7 days, and not once did he take his shirt off on the beach. I mean, that's a pretty significant insecurity about your weight. So, I think boys may not have the eating disorders, but they certainly have, some real insecurities that they don't look like, the guy with the six-pack on the front of the male fitness magazine, which is just as unrealistic as the size 0 supermodel, so.
Melanie, I leave it to you to close tonight.
Oh no, why do you do this to me? It just popped in my mind. If you have anyone in your life that has an eating disorder, just try your best to show them love. It can be incredibly uncomfortable for families to sit around a table with someone that's bulimic or someone that's anorexic, but just try to look past it and see the person and give them as much love as you can. That's kind of my ending. How about you, Paul?
Yeah, and if you do have a loved one who's anorexic or bulimic, do whatever you can to get them into good care, good psychiatric care and therapy. And if they're doing it to a dangerous proportion, like vomiting daily, or if their weight is 20% below the normal weight or more, then they really ought to be hospitalized, because there is a high death rate for both of those groups.
Yeah, Yeah, or just, instead of asking them about their behavior, the symptoms that you see in front of you, maybe just sitting down and saying, how are you feeling? Why don't you tell me what you're feeling today? Or just try to get them to talk about their feelings, encourage them to journal something. Just stay away from calling out the behavior, because as soon as you do that, they're going to throw a wall up so fast you're never going to get through. So
journaling is another thing that we do in therapy. I forgot about that.
Mm-hmm.
If somebody's bulimic, then whenever they feel like it, whenever they feel like vomiting, not only do they stop and figure out what their emotions are, but they journal it and write down what were they feeling right before that, what triggered it, what was the emotion they were trying to numb, and then they can share it. They can call somebody else that's struggling with it, that's in a group with them or something, or they can wait and share it with the therapist later. But when they journal and get in touch with their emotions, lots of times they're able to not go ahead and vomit it at those times.
Yeah, I used to have clients journal too, Paul, and then we'll wrap up because I know we're running over time. But one of the things I saw a lot with journaling, when they would want to share, I didn't always require that they share with me what they had journaled, but when they did, a recurring narrative was, I hate myself, I hate my body, I hate the way I look. I mean, it's just a lot of self-hate involved in eating disorders, I think. That's a big piece of it. So
they were basing their worth on how they looked.
Yep, exactly.
And I'll tell you this to the two of you. Part of my wonderful late 40s life is all about practicing self-care, which is something I didn't even know what that meant for a very, very long time. And part of my self-care and loving myself exactly as I am right now is when the three of us get on and do these shows every week, because I love the word that you say, Paul, with fellowship. I feel like when we're done, I feel like this is an act of self-care, because these are really nice, caring people, and I must feel that I deserve to spend an hour with these people every week. Does that make sense?
Yeah, thank you too.
Aw.
I feel that way too.
Yeah, that show is always uplifting, no matter how heavy our topics may get. We always get off the phone feeling like,
That was a pun. How heavy our topics get.
There we go.
Just thinking that. Or light.
I think that's a great way to wrap up. Thank you, everyone, for listening to another episode of Mental Health News Radio.
But never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps. Or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it.
Good boy. You've reached the High Fashion Hotline.
Hi, my family's going to a concert in the park, and we want our style to be the main attraction.
Rock over to Old Navy.
Old Navy?
Yep, right now get up to 50% off jeans from $15 for adults, $10 for kids at Old Navy and OldNavy.com.
Up to 50% off jeans for the family? That's music to my ears.
Plus, now you can get in and out of the store in a flash with buy online, pick up in store. It's fun, fast, and free.
Styles that take center stage and free pickup in store when I buy online? Old Navy, here we come.
High Fashion, Old Navy. Valid 7/20 to 7/29. Select styles only.